Hello everyone, I'm Dr. Ghanee. I am an oral pathologist. Today I'm going to talk about geographic tongue. Geographic tongue is very common and people who have it, usually they're aware of it. They know they have it. Usually it is not symptomatic, but there are few cases, very small percentage of geographic tongue cases that they are symptomatic. What is geographic tongue? Look at the top of the tongue. We have these small little projections that we call them papilla. In geographic tongue, for unknown reason, one area all of a sudden loses all those little projections and it becomes red and glossy and always has this kind of tan line all around it. That's why it looks like an island. Look at this one. It has the same tan yellow line all around it. Geographic tongue can be very prominent with a lot of islands and continents on top of the tongue, and it can be very subtle. It constantly changes. For example, this area, if you check this patient after 1 month, this area is completely normal, and something like this you might see here. That's why they call it migratory glossitis. We never treat geographic tongue, but those people that they have sensitivity and it's bothering them, I always do diet review and I give them instructions. I ask them to avoid acidic, spicy, or salty food until their tongue recovers. Sometimes it's a large area and the tongue is very sensitive, but after like a few weeks, that area heals and maybe smaller areas start. That's why sensitivity kind of comes and goes to certain food. This is another view that you can see those little islands. In kids, geographic tongue is very different. It never shows that patchy pattern, little islands with that white halo around them. It's always like this. It's a large area that has lost the coverage and it doesn't have that tan color. In kids, it looks really different, and a lot of times parents, they bring their children and they're very worried about it. But definitely there's nothing to worry about. Geographic tongue most of the time is on top of the tongue, but sometimes it's on the side, sometimes it's underneath the tongue, floor of the mouth, or palate. One important thing is lateral tongue, side of the tongue, is the most common site for oral cancer. So if I don't see this as multiple lesions, very classic of geographic tongue, if I see just one spot, I have to be careful because it could be beginning of oral cancer. I have seen cases that patient had oral cancer and got missed and the clinician thought it was geographic tongue for some time. How do we know? If I am sure it's geographic tongue, still I recheck the patient. If I am not sure, definitely I check the patient in 2-3 weeks to make sure that area is healing and another area is showing it. As I said, geographic tongue always keeps moving, and that's why it's called migratory glossitis. That's why having really good pictures help, because when patients come back, we can take another picture and compare. Thank you so much for watching this. Have a good day.